Hey there, VCE HHD students. My name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're looking at programs to improve Aboriginal and Torres Strait Islander people's health and how they promote social justice. This is relevant to Unit 3, Area Study 2 for the 2025 plus HHD study design. If you don't already, there's a number of ways to engage with the Health Resources Hub. If you're on YouTube at the moment, you can subscribe with the button in the bottom corner of the video there to our YouTube channel. That means you'll get alerts to all of our new videos coming out across the year. Also got our website, thehrh.net.au, where there's opportunities for students and teachers of HHD, and that's being updated regularly, so please check that out. Also got our Instagram, TikTok, and Facebook pages where you can follow us and get alerts to our new videos and other opportunities, as well as SAC and exam tips and advice, and also our email, info@thehrh.net.au. Okay, so let's dive into this video. So the first part of the video here is looking at what parts of the course does this relate to. So for Unit 3, Area Study 2, you can see the key knowledge and the key skill that are relevant to this video here. So the key knowledge is talking about programs to improve Aboriginal and Torres Strait Islander people's health, including how they promote social justice. So obviously there, if it's focusing on programs that are improving the health of this particular group, remember that health refers to both health and well-being dimensions as well as health status indicators. And then we'll look at this term social justice and what that means and how you can look at whether or not programs are promoting social justice. And then you can see there the Unit 3 key skills. So analyse initiatives introduced to improve Aboriginal and Torres Strait Islander people's health and wellbeing in Australia and how they reflect the action areas of the Ottawa Charter for Health Promotion and Social Justice. So we have done a whole video previously on the action areas of the Ottawa Charter and how to apply those to case studies, okay, and programs and scenarios. So we won't focus too much on that in this video, but you can go back into our back catalogue and have a look at that video, and you can have a look at all the different action areas of the Ottawa Charter and what they mean and how you can apply those to different programs. We'll focus a bit more on the key skill point there regarding how these programs can promote social justice. So first of all, let's look at, well, why are these programs for Aboriginal and Torres Strait Islander people important? And so we have talked about in previous videos that health promotion programs often focus on particular population groups, especially those that might experience health inequalities, and Aboriginal and Torres Strait Islander peoples fall into this category. And so it's hoped that by implementing such programs that might contribute to improvements in health, wellbeing, and health status, and then hopefully can address perhaps some of these factors that might contribute to some of the health inequalities that are experienced. I have given some examples on this slide here of some variations in health outcomes experienced by Aboriginal and Torres Strait Islander peoples compared to non-Indigenous Australians. Now, you're unlikely to be asked about these specific examples, but it is good, I think, to get a sense of what some of these variations might be and some of the impetus for some of these particular programs. This might be presented to you, however, in some data, and that could be linked, okay, to an overall question, okay, that could link in both Unit 3 Area Study 1 and looking at sort of population groups and the factors, and also then perhaps link into this aspect of Area Study 2, where it might look at a particular program for Aboriginal and Torres Strait Islander people. So you can see there a number of those variations in health outcomes include lower life expectancy, lower HALE, high morbidity and mortality rates for a range of conditions, as well as high levels of psychological distress and higher rates of infant mortality. So these are just some examples, and others are there as well, but this is sometimes some of the reason behind some of these particular programs to try to address some of these health inequalities. So before we dive into an example of a program and a sample question, let's just look at what is social justice. So social justice relates to fairness within society. It's the fair and equitable distribution of resources, opportunities, and privileges in society. And so this is relatively new to the 2025 plus HHD course, especially in relation to these particular programs. And so when considering programs that are relevant to Aboriginal and Torres Strait Islander peoples and how they might promote social justice, by focusing on the 4 principles, okay, that social justice is based on that are mentioned on that slide there, that can help you then make links from a particular program to how it could promote social justice. So you see there, human rights is one of those principles, so that society should protect and respect and promote everyone's rights and freedoms, regardless of a range of factors. Access, that everyone in society should have access to equal opportunities and the resources they need, okay, to thrive, and give some examples of those. Participation, everyone in society is encouraged to participate in the community and have their voice represented. And then equity. So equity is not necessarily the same as equality. It's not treating everyone equally, but providing what disadvantaged individuals or groups require to achieve the same level of health and well-being as others. And so it mentions there that equity should address the factors that cause inequality and provide strategies to ensure fairness. So all of these are examples of principles of social justice. So if you can look at a particular program, okay, linked to Aboriginal and Torres Strait Islander peoples, and then you can link it into some of these examples of these principles, then you can say that the program is also promoting social justice. Now, you might have to link that onto how it then improves health outcomes, okay, of Indigenous people. So, as I said before, health and health outcomes refers to health and wellbeing dimensions as well as health status indicators. And also you could have to look at a program and link it into the action areas of the Ottawa Charter. So I think they're the sort of three main things to focus on for this key knowledge point: how a program can be linked to the action areas of the Ottawa Charter, how it promotes social justice, and how it can improve health. So this is just one example of a sample program, the Two Spirits program, and then we'll have a look at a question on the following slide, which is asking how this program can promote social justice. So perhaps as we're having a look at this program here, you can be thinking about those principles that we were just talking about before and how they could be linked to this program. So you can see here, Two Spirits is a program that aims to improve the sexual health of Aboriginal and Torres Strait Islander peoples who identify as LGBTQI plus SB. And so the program has services that are directed at partners, family and friends of LGBT IQ plus SB, Aboriginal and Torres Strait Islander people, as well as people living with HIV and the wider community. And it gives you some examples there of some of those services. And so it says things like printed resources and campaigns, peer education workshops, community forums, retreats for gay men, sister girls, and people living with HIV, and social support groups. So from this information here, you'd be expected to be able to obviously link into the action areas of the Ottawa Charter. Now, not all action areas will be relevant in all programs, but I always say to my students that I'd be looking out for particularly develop personal skills as one of sort of the first ones that I'd be thinking about in relation to a program if you're given the option to choose an action area, because nearly all programs have some aspect of education knowledge and skill building, and there's lots of examples here that you could link into in improving people's understanding of sexual health, okay? And so another one that you can think about also is creating a supportive environment. So there's lots of things you can draw on here, these community forums and retreats, providing opportunities for Aboriginal and Torres Strait Islander, LGBTQI plus SB people to engage, okay, in this kind of forum or these kind of retreats, which is promoting and trying to improve their sexual health. So there's lots of opportunities there to link into action areas of the Ottawa Charter. But then also you could get a question like this. So outline how the Two Spirits program promotes social justice for Aboriginal and Torres Strait Islander people, and that could be worth a couple of marks. So you can see that I provided a sample answer that mentions that this program provides access, and so it's giving examples of the resources such as the education and the focus on sexual health, and that can help to empower Aboriginal and Torres Strait Islander people to increase control over their lives and their sexual health, so providing access to this information and these resources through participation in the program. And that's helping to promote social justice for groups that might not always be able to access this kind of information. It also promotes human rights as it's working to ensure things like sexual orientation and gender identity are not barriers to accessing resources such as sexual health services, because obviously the program has that particular focus on these particular groups. So that's a way that you can think about some of those principles of social justice and then linking them into a program with a meaningful example so that you can outline how it promotes social justice. Obviously, you could then get a question that asks you how this could then promote health or health outcomes, so linking it to health and well-being, okay, and health status as well as something that you might want to practice. If you did want some more of these kind of scenarios or case studies or programs and then sample questions, you can see down the bottom there, we've got our free student newsletter. It comes out a couple of times a term with free SAC, resources and advice for Unit 3-4 students. So I'll be sending out some more of these examples in the coming weeks. So if you haven't signed up to that, you can head to our website there, the hrh.net.au, where there'll be opportunities there for you to get access to those. Also, we've got this revision question book that I've worked on with ACE for the 2025 plus study design. It's got lots of practice questions across the whole course, as well as sample answers. It's got over 500 marks worth of practice questions and sample answers. It also has a full chapter on extended response questions, which will be particularly helpful if you've got an extended response question SAC coming up, or for the end of your exam, where section B is that extended response question. It's also got a full trial exam with sample response as well. So you can head to book.acevc.com if you'd like to get a copy of that in the post. Okay, thanks so much.